I'll tell you, one thing is shocking is how many patients think they're not supposed to talk about politics in therapy,
That they think they have a responsibility as a patient not to do that.
that they're not supposed to, and they think that about religion too. Some think they're not supposed to talk about religion too. It's a lot of them do. And that's what therapists actually have to do a little bit of work to open up that if those are things that are on your mind that are impacting you, it's okay. It's probably good. It's probably necessary to talk about those at least a little bit. But a lot of people think they're not supposed to, and they self-censor, and they probably underestimate how much the entire therapeutic process can be derailed when you're self-censoring parts of your life like that.
I read someplace, I think maybe on your website, that you created the institute to address polarization in mental health care. Is that a formulation that is familiar to you?
Um, I don't think I framed it that way, but I'm curious where you're going with this.
Well, so from what you just said, that strikes me as an accurate account of that line I just mentioned about addressing polarization. Polarization is something that I think can have the effect of creating loneliness for people, creating dysregulation, as you talked about, feelings of extremist thinking. It's the end of the world if Harris wins, or it's the end of the world if Trump wins.
Right.
The end of our society, the end of America as we know it. Both sides seem to use that kind of rhetoric. It's
Mhm.
Hitler coming, or it's communists coming, the Marxists are coming. So there's kind of this extreme thinking happening in a polarized society. And I would think that in cases of polarization, there's perhaps a greater need for therapy and a special
Right.
kind of need for people who are feeling lonely, feeling beat up at work, trying to understand what their role is in a society with a very complex and in many ways horrible racial history. What
Right.
does it mean to live in that society and
Right.
still be the person you are, right? And
Yeah.
have an appropriate understanding of, are you responsible for all of this? Are you a good person? How do you live your life? How should you move through the world? I mean, I gather those are triggers for the need for therapy. And then we're talking about when they get therapy, they don't actually get the responses that they might be getting.
Right. Well, I mean, I think you and I were talking earlier about how um, over with all the kind of like political chaos that's happened over the past decade in particular, and I feel really strongly that tools from psychology and maybe clinical psychology in particular can really be indispensable at diffusing tensions, fostering dialogue, helping people understand, helping people repair, helping systems become more functional. And I think it's been a huge missed opportunity that the field hasn't done more work to foster that. Um, in terms of polarization, like I I would say the the country is very polarized, and people are feeling that. Um, the mental health field, I think, is less polarized because there's just one pole. There is no counterpoint. You do find there are individual therapists who are right wing and do things that I would consider unethical, politicizing sessions. They exist, and they say crazy stuff too. There's definitely some of that, but I think like psychology professors are 17-1 liberal to conservative. I think therapists are 90, 92, 93% liberal to conservative.
Wow.
The conservatives tend to not write articles, not speak about it, not teach about it, be in the closet about it, self-censor, and so
So viewpoint diversity is a massive issue.
it's a massive issue, and there's only it's very unequal, and so um, there's the that's the issues that tend to get ignored and the perspectives that tend to get ignored are almost always on the center and on the right. Um,
Are there other systematic biases in the profession that might be related to, for example, socioeconomic class? Do we know about that, or gender?
um, oh well,
Is there a system?
gender for sure because the field is really female dominated. And I think it's 80% of therapists are are women. That gap is getting bigger, um, and I'm actually having second thoughts if it's exactly 80%, but it's something in that ballpark. Child therapists, it's even more extremely geared towards women, and men's issues are often really mishandled. I mean, the place where I see it I'm particularly concerned about it is couples therapy. I'm very concerned about biases against men in couples therapy, that so many couples therapists are women. They don't understand men's issues. They might pathologize men as being more aggressive, as being less supportive, as being more narcissistic. They might undervalue men's needs in relationships. And it shows there are all of these subtle ways that bias can come into sessions. It's not always like the big sledgehammer of explicitly politicizing a session. It could just be like a tendency to stereotype men as the bad guy in the relationship.